Welcome to a Chesapeake Public Schools Family Empowerment webinar presented by the Office of Family and Community Engagement. Our office, which is part of the Department of Engagement, aims to build meaningful partnerships that inspire, engage, and empower families, educators, and community organizations to support the initiatives of Chesapeake Public Schools. You can reach us at our main phone line or via email at the contact information listed on the screen. Thank you for joining us, and we look forward to working together to strengthen our community and support our students. Our goal is to continue providing families with valuable webinars, events, and information to empower them in the educational setting. We're excited to offer our families the Peak Parent University course catalog, which provides an overview of all of our events for the school year. Here, you can also catch up on pre-recorded webinars, explore a wide range of educational resources, and make valuable community connections to enhance your family's well-being. Please take a moment to scan the QR code, which will give you access to our Peak Parent University. This will provide you with monthly updates, including descriptions, times, and locations of upcoming events. You can also go to cpschools.com and in the search menu, type Peak Parent University. Thank you for joining us for the Autism 101 webinar. We're excited to welcome our panelist from the Autism Society of Tidewater, Virginia, Program Coordinator Brittany Fitzgerald, who will share information and resources regarding autism.
Thank you so much for having me. The Autism Society of Tidewater, Virginia's mission for the past 42 years has been to create connections, empowering everybody in the autism community with the resources they need to live fully. As an affiliate of the nation's oldest leading grassroots autism organization, the Autism Society of America, we have served thousands of members of the local autism community each year. Our vision is a world where everyone in the autism community is connected to the support they need when they need it, including education, advocacy efforts, and supports and services throughout the lifespan. The connection is you. And these are our contact information and location. We're located in Virginia Beach, off Virginia Beach Boulevard, and my email, brittany.fitzgerald@tidewaterasa.org and whitney.king@tidewaterasa.org. And then our social media channels are below as well. So some of the programs and supports that we offer, we have an Autism 101, Autism 201, which are on our website. We do some law enforcement and EMS training. We do parent web chats. So we have the parents of adults on Tuesdays nights, the first and third Tuesdays, and then the first and third Thursdays are the parents of children. We also have programs for teens and adults. We have our art program, which is for people 18 and above who have autism. And we have our virtual support group, which is for 18 and up, and we who have autism. We have our Parents Night Out, as in-person support group for parents and caregivers in Virginia Beach. We do lots of resource fairs and conferences, and we do a number of family gathering events, such as family fun days, 5K runs, holiday parties, and sensory-friendly events. So these are the objectives. We're going to have an introductory understanding of autism spectrum disorder, recognizing some of the characteristics and behavior, and some strategies for support and inclusion. So the definition of autism spectrum disorder, they have these: you need persistent deficits in social communication and interaction, restrictive, repetitive patterns of behavior, interests, or activities, neurodevelopmental disorders, including autism spectrum disorder, can co-occur with developmental disabilities, including intellectual disability, mental, and behavioral problems. Next slide. So some early signs of autism is no babbling by 12 months of age, no pointing or gesturing by 12 months of age, no single words by 16 months, no two-word phrases by 24 months, loss of acquired skills, especially language, a lack of joint attention, they do not draw other people's attention to objects, lack of pretend, imitative, and functional play appropriate to their developmental age. They do not imitate others' behaviors. They're rigid in routines and have a very difficult transitions. Child engages in repetitive or stereotypical behavior. Child has unusual response to sensory stimuli. The prevalence rate for autism is now 1 in 31 children receive an autism diagnosis. This means that while diagnostic screening and identification are improving, in some ways prevalence rate are also increasing. The female protective effect. One of autism's most persistent puzzles is why 4 times as many boys are diagnosed with the condition as girls. Autism manifests differently in girls than it does boys, but the tools to diagnose for and screen for autism are based primarily on data from boys. They often do not account for the variation in autism characteristics across sexes. As a result, many autistic women and girls are diagnosed with the condition late in life or not at all. And this underdiagnosis may lead to a skewed sex ratio. So medical diagnosis is made by a psychologist, developmental pediatrician, or other specialized physician based on an assessment of symptoms and diagnostic tests. A medical diagnosis of autism spectrum disorder is most frequently made according to the DSM-5 of the American Psychiatric Association. It guides physicians in diagnosing autism spectrum disorder according to the specific set of criteria. So as team of clinicians, we'll work with you and your family to decide an individualized diagnostic evaluation that will likely include multiple appointments. This includes the intake appointment, testing appointment, feedback appointment, and follow-up appointment. So there are 3 functional levels of autism. ASD level 1, they require support, difficulty initiating social interactions, organization planning problems can hamper independence. Then we have ASD level 2, require substantial support, social interactions limited to narrow special interests, frequent restricted repetitive behaviors. And then ASD level 3, they require substantial support, severe deficits in verbal and nonverbal social communication skills, great distress or difficulty in changing actions or focus. So this is some more information about ASD level 1. So social communication, without help and support, some deficits in social communication, difficulty starting social interactions, and can speak clearly with adults but doesn't wish to speak with peers. And restrictive repetitive behaviors, inflexibility cause significant interference with functioning, difficulty changing activities, and problems with the organization. ASD level 2, social communication, deficits in verbal and nonverbal communication, limited in initiation of social interactions, example, narrow interests, Restrictive repetitive behaviors, inflexibility, difficulty coping. Restrictive repetitive behaviors occur enough for others to notice. ASD Level 3, severe deficits in verbal and nonverbal social communication skills. Example, a few words of intelligible speech, rarely initiates interaction. Restrictive repetitive behaviors, inflexibility of behavior, difficulty coping. Repetitive behaviors that interfere with functioning. So another characteristic is executive dysfunction. So some characteristics of that are difficulty initiating action, difficulty planning ahead, inhibiting appropriate responses, absence of strategy monitoring, difficulty regulating their own behavior, and thinking less of themselves. And a note, this is our skills that typical adults and children have the capability to do. Some common strengths among autistic individuals: strong rote memory, strong attention to detail, strong areas of interest, strong moral code, logical thinkers, and honest. Some support options that exist: occupational therapy for sensory food motor, speech therapy for communication, behavior, ABA, behavior consultation, educational, IEP 504, independent living skills, and mental health services. So some accommodations during community interactions. Does the individual need reduced sensory stimuli? So do they need headphones or quieter location? Do they need sensory stimuli? Do they need a fidget or food? Does the individual need a parent or caregiver to assist with communication? Do they need a communication device such as a communication board or an iPad? Does the individual need more processing time when asked a question? Does an individual understand your body language? If not, you might have to explain it to them. And this is an example of a communication board. So they would point at the graphic, and that would let you know what they're trying to tell you. So some tips in special education. There are 5 steps in the special education process: identification and referral, evaluation, determination of eligibility, development of an individualized education program, and determination of services and placement. And then there is a re-evaluation conducted at least every 3 years. To be eligible for special education services, the child's disability must impact their education and require specialized instruction. And a medical diagnosis and an educational diagnosis are not always the same. So the educational definition of autism. So for autism means a developmental disability significantly affecting verbal and nonverbal communications and social interaction, generally evident before the age of 3, that adversely affects the child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities, stereotyped movements, resistance to environmental change or change in daily routines, and unusual response to sensory experiences. Autism does not apply if a child's educational performance is adversely affected primarily because the child has an emotional disturbance. The child who manifests the characteristics of autism after age 3 could be identified as having autism if the criteria in the definition are satisfied. So what is the difference between the IEP and the 504? So the Individuals with Disabilities Education Act is a law that makes available free and appropriate public education to eligible children with disabilities throughout the nation and ensures special education and related services to those children. IDEA governs how the individualized education plan is constructed and implemented. Currently, the Virginia Department of Education uses standards-based IEP, which is tied directly to the state's content standards. Both the students' present level of performance and some of the annual IEP goals are aligned with and based on the state's grade level standards, which creates a program that is aimed at getting students to a proficient level on the state standards. And then Section 504 of the 1973 Rehabilitation Act provides special accommodations for qualifying students with a medical or mental impairment that substantially limits major life function. It provides equal access. 504 plan is constructed by the school staff to give the child special considerations or accommodations with the classroom climate, seating arrangements, health services, modified assignments, testing accommodations, behavioral management plans, transportation, and modification of physical education. So some education tips and reminders: keep good records, document in writing any conversations that you have with teachers, staff, or administrators. You can call an IEP meeting at any time. You can take a friend, family member, educational advocate with you to IEP meetings, but let the IEP team know in advance. IEP team can discuss involvement of the family assessment and planning team from your local CSA to discuss private day placement and our other supports. Request in advance any reports or documents that will be discussed during upcoming IEP meetings. So these are some important acronyms and abbreviations. So we have 504, the section of the Rehabilitation Act of 1973, ADA, Americans with Disability Act, DD, Developmental Disability, ED, Emotional Disability, FAPE, Free and Appropriate Public Education, FBA, Functional Behavioral Assessment, IDEA, Individuals with Disabilities Education Act, IDEIA, Individuals with Disabilities Education Improvement Act of 2004, LRE, Least Restrictive Environment, OT is Occupational Therapy, PDD, Pervasive Developmental Disorder, PWN, Prior Written Notice, SEAC, Special Education Advisory Committee, SI, Sensory Integration, SLD, Specific Learning Disability, SPL, Speech and Language, SPED, Special Education, VDOE, Virginia Department of Education, VAAP, Virginia Alternative Assessment Program, and VGLA, Virginia Grade Level Alternative Program. So when we're doing activities, we like to think of saved. Structure, make it a consistent routine that the individuals can follow. Audio music, use noise canceling headphones or add in favorite music or sounds. Visuals, use schedules and checklists, social stories, and live role playing. Environment, know the environment that you will be entering. Differentiation, make it appropriate for each individual. So these are some more therapeutic options: speech therapy, occupational therapy, physical therapy, applied behavioral analysis, cognitive behavior intervention, parent-child interaction, dialectical behavior, positive behavioral support therapy, therapeutic recreation, equine therapy, and many more. And there are scholarships or grants. If you go to our website, www.tidewaterasa.org, we do have a section that has a number of scholarships and grants on it. Virginia Medicaid waivers are home and community-based services that allow all individuals with developmental disabilities to remain in their own homes, and our community settings with direct services programs waive their placement in an institution or nursing facility. Only qualifying individuals' financial information is evaluated. That therefore, if you have a child who qualifies for a Medicaid waiver, then only their income and assets will be considered, not the parents or caregivers. And autism is not an automatic criteria for any of Virginia's Medicaid waiver programs. The applicant will need to have significant needs, functional needs, activities of daily living skills, and/or medical needs to qualify under the Uniform Assessment Instrument or the UAI. For the Commonwealth Coordinated Plus Care CCC Plus waiver and the VIDES Virginia Individual Developmental Disability Education Survey for the Developmental Disabilities Waiver Program. So we'll explore two different Medicaid waiver programs in the state of Virginia. So we have this Commonwealth Coordinated Care or the CCC Plus waiver, formerly the Elderly or Disabled with Consumer Directed waiver, and the Technology Assisted waiver. And then we have the Developmental Disabilities Waiver Program. So that is broken down into three sections: building independence, family and individual support, and community living waivers. So for the CCC Plus, services offered includes adult day healthcare, assistive technology, environmental modifications, medication monitoring, personal emergency response system, private duty nursing, personal care assistance, respite care, skill and intermediate nursing facility or long stay hospital, transition services moving into the community and out of a nursing facility. So the developmental disability waiver has three waivers. Building independence waiver. This waiver is for adults 18 years and older who are able to live independently. People with this waiver usually own, lease, or control their own living arrangements. Some supports are complemented by non-waiver funded rent subsidies. They do not need support all the time. And then the family and individual support waiver is for this waiver is available for both children and adults. People with this waiver may live with their family or friends or in their own home. Some people may need supports with some medical and behavioral needs. And then the community living waiver, this waiver is available for both children and adults. And this waiver, people on this waiver usually require supports at home at all times. They may not meaning to live in these homes with staff and supports and had complex medical needs. And here is some contact information for the Medicaid waivers program. You can contact your local community service board. We have listed the phone numbers for the cities. And what documents do you need to apply? A recent psychological evaluation completed within the last 3 to 5 years. Diagnosis paperwork indicating the individual has a developmental disability before the age of 22. IEP plan or 504 if your child is or adult is still in school or recently graduated. Early and periodic screening and diagnostic and treatment. The early and periodic diagnostic and treatment benefit is geared to early assessment of children's healthcare needs through periodic screenings. The goal of it is to ensure that health problems are diagnosed and treated as early as possible. Services included personal care assistance, consumer or agency directed, specialized services including inpatient and residential treatment, behavior therapy, private duty nursing, assistive technology, audiology and hearing aid, medical formula and nutritional supplements, and diapers and pull-ups. And some safety resources for people with autism. There is the Virginia Missing Persons with Autism Alert that allows the state police to issue an alert at any age for an autistic individual. And JP's law also allows individuals to voluntarily check the designated 9 code on their license application that lets people know that they have autism. And there's Project Lifesaver. It allows individuals to wear regular radio frequency on their device on their ankle, wrist, so that the device can be activated for the purpose of tracking the individual if they wander or elope. And then digital cards. And this is some local information for Project Lifesaver. And other resources from the DMV, they have handicap placards for individuals with autism spectrum disorder. The requirement is you have to get a physician to sign, and it's a $5 fee. And Big Red Safety Box is a free tool that families can sign up for. And this is our office information again. We're located on 3509 Virginia Beach Boulevard, Virginia Beach, Virginia 23452. Our phone number is 757-461-4474.
Thank you so much, Brittany, for your wealth of information. To access the links that were provided in this presentation, please scan the QR code on the screen. Please feel free to reach out to the Autism Society of Tidewater, Virginia for any questions or resources. Keep in mind that Let's Talk is the perfect two-way communication for any comments, questions, suggestions, or concerns that you may have for Chesapeake Public Schools. Also, you can stay connected through the different platforms that are listed on the screen. Make sure you scan the QR code to download our app to receive notifications about important events. Remember, families and communities work better together.